Hi there, my name is Taylor Sipos. I'm a registered physiotherapist with the Orthopedic Therapy Clinic.
And I'm John Gray, registered kinesiologist at the Orthopedic Therapy Clinic.
And today we're going to be talking to you about whether or not you should be exercising when you have pain. So when you're determining whether you should be exercising with pain or not, the first concept we'd like to introduce to you is the idea of a yellow light, a red light, and a green light. So, for example, a red light would be when you have a medical condition or an injury where you should absolutely not be exercising with that condition. So a good example of this is, let's say you've recently fractured your shoulder. Your physiotherapist or your doctor is probably going to have you not doing any kind of strengthening, not doing any kind of range of motion those first couple of weeks. So in that case, you wouldn't want to be exercising that area. The yellow light is where you don't have any restrictions per se, but there might be a little bit of pain with your exercise. So maybe you're recovering from a rotator cuff injury and you're trying to get back to the gym and you're experiencing pain. That would be a yellow light where you should be trying to do some sort of exercise, but you should be proceeding with caution. And finally, there's the green light. So the green light is where you're not experiencing any pain with your exercises and you can progress and complete the exercises with relative comfort.
So an important concept throughout this entire stoplight analogy is that you're only doing the exercises that are correct for the phase of healing that you're in, or we give you the right exercises at the right time. This lets you stay fit during your rehab program, which is also going to assist in your overall recovery by reducing the amount of time before you can get back to your regular duties, and also to avoid detraining in other areas, particularly in really active populations.
Now, looking at this stoplight analogy, you may think that the red light scenario is the most problematic, but we actually find that it's the yellow light that gives people lots of problems. This is where we're cleared to begin exercising and we should be doing some form of exercise, but we're experiencing pain and we're not quite sure whether we should be proceeding with that pain. So we're going to give you some tips and some tricks on how to deal with pain during your exercise and when you're in that yellow light of exercise.
One of the most popular ways of tracking your pain level during exercise is to use a scale from 1 to 10, where 10 is the extreme pain might cause you to go to the emergency room, but 1 is like minimal to no pain at all. And while it's not uncommon for people in the yellow light kind of phase of their healing to have some pain, we want it to be no greater than between 4 or 6 out of 10. Definitely not increasing that much. Now, during exercise, it is okay for the pain that you're experiencing either to stay as it is at, let's say, 4 out of 10. And in some cases, you might notice it starting to elevate a little bit. As long as the pain goes back down to your pre-exercise level that you experienced within a reasonable timeline after you finished exercising, then that is still okay. And for us, as long as it comes back down to where it was before you worked out by the end of the day or the next day, that should be fine. If it stays elevated, you may have done a little bit more of an irritation of the tissue, and so we would look at revising exactly what you're doing, maybe pulling back a little bit on the number or the type of exercises that you're doing, just in order to get that forward progress again. So if you do exercise and you notice that your pain is elevated into the next day after finishing, then it's likely that you've probably had previous workouts or previous exercise routines prior to the current one that you're doing. And the best advice would be to return back to that exercise program you had that was the most recent one that didn't give you any additional increases in your pain level.
So to give you a practical example on how to interpret your pain during your exercises, let's say in scenario 1, I have a shoulder injury and I'm trying to complete some exercise to help rehab it. Let's say I go to start my exercises and my pain is a 2 out of 10. In this scenario, let's say I increase my pain to a 6 out of 10, but it goes back down to about a 2 out of 10 within 3 or 4 hours. So in that case, we'd be really happy with the patient continuing on with those exercises. There was a temporary increase in pain that didn't last very long. That's actually a good thing because sometimes it's okay to stress those structures, and we know that it's not creating enough pain to set you back or to cause a flare-up or anything like that. However, in scenario 2, let's say it's the same shoulder injury. I go to do my exercises. I have a 2 out of 10 pain. It increases to a 6, and then that lasts for the rest of the day and even into the next day. that would be a case where that would be too much pain during those exercises. And what we would want you to do is to go back to that most previous exercise routine that you were completing that wasn't causing any type of pain. Now, there are also some pitfalls that you want to avoid while completing your exercises with pain. The first thing that we like to tell people is we try not to get our patients to have a firm deadline to get back to a particular activity. In general, we try to ask them to have more of a range of a deadline. We just find that when people have a firm deadline, it may cause them to push through their exercises a little bit more, experience a little bit more pain throughout their exercise routine, and that can actually delay healing and actually cause you to miss that deadline and just add more time to getting back to your activity level. So we find it's a little bit better to have more of a range. It gives you a workable goal to have to get back to that activity, but it might allow you to complete the exercises a little bit more efficiently while you're doing that.
Another thing that people will often do to feel better, to reduce the pain that they're experiencing during exercise, is to take NSAIDs like Advil or just off-the-shelf ibuprofen from the drugstore. Now, yes, they do a very good job of decreasing inflammation and pain associated with musculoskeletal conditions, but often they're most indicated in the initial phases when you just have that initial inflammatory phase. And it is a bit controversial as well. Some people suggesting that there are better ways of going about it. However, we are pretty consistent with each other that later on in your exercise program and during your recovery, using NSAIDs can actually prolong your recovery. And so therefore, we would rather that you changed your types of exercises, the loading, the repetition range, the different program structure to facilitate those tissues feeling better sooner rather than reaching for a bottle and taking pills on an endless basis.
We hope this discussion has helped your understanding on how to deal with pain while completing your exercises during recovery from an injury. If you did find this helpful, give us a thumbs up by clicking the like button.
And you can also stay up to date with us with our future videos by subscribing to our channel. And please, if you know of anybody who this might apply to, share the video. It helps us to get more reach out into the YouTube world, and we'd really appreciate the help. Thanks very much.